All right, so welcome guys to our own online discussion. Before we proceed, can we all introduce ourselves? My name is Rebecca.
Hi everyone, it's nice to be part of this discussion. I am Joana.
Virnhet.
Good afternoon, everyone. I am Tricia.
Hi guys, I am Jessica.
I know that everyone is already excited for today's discussion since we will be able to learn, connect, oppose, and refute to this very sensitive topic, which is euthanasia, since it continues to be associated with strong moral convictions. And without further ado, let me introduce our topic. So, euthanasia is an easy or painless death or the intentional ending of the life of a person suffering from an incurable or painful disease at his or her request. This definition defines the act called euthanasia or more known to many as mercy killing. Euthanasia is a Greek phrase that means a good death, and the bioethical dilemma of euthanasia involves the recognition of autonomy and the right of the patient, who is an adult, to decide for their own health care, wherein they have the decision of continuing or withdrawing the life sustaining treatment, even in circumstances where a person is gravely or terminally ill or in a permanently unconscious condition. So, in the Senate, Senate Bill 18 was previously filed by the late Senator Miriam Santiago in attempt to legalize euthanasia in the Philippines. And however, to this day, euthanasia as well as physician-assisted suicide is illegal in the Philippines. So the ethical dilemma of euthanasia is it is an act that deliberately ends the life of a person upon their request, and it is morally unacceptable and only in circumstances that a person who is gravely ill will receive palliative care, wherein the decision should be made by the patient to relieve his or her suffering until he or she passes through the natural process of death.
So the argument for today's discussion is whether we agree or disagree with the legalization of euthanasia in the Philippines.
Yes, and after days of studying, scrutinizing, and criticizing both sides of the argument, we hereby state our disagreement with the legalization of euthanasia in our country.
In fact, we prepared 4 points on why euthanasia should not be legalized. First, all interventions that put life at jeopardy for no justifiable reason constitute a negative attempt against it. The purpose of euthanasia, often known as mercy killing, is to alleviate the patient's suffering. According to Dr. Manalo in one of the FEU Public Intellectual Lecture Series episodes, patients who frequently request euthanasia suffer from a chronic or fatal illness as well as existential distress in which they are wondering, why me? According to her, accepting euthanasia is equivalent to eliminating the patient or the sufferer instead. Doctors are prohibited from suggesting euthanasia because they are obliged to keep their patients healthy. Hence, doctor in palliative care will alleviate suffering without eliminating the patient. Second, euthanasia devalues society's regard for life's sacredness. It is still remain illegal in some countries for various reasons, including the fact that it would alter society's view of human life. Legalizing euthanasia could weaken the nation's regard for life. According to Math and Chaturvedi, many people believe that if we accept euthanasia, or the freedom to die with dignity, those with incurable diseases will be wiped out of the society. Eliminating the invalid is not a good idea to end someone's suffering. Palliative care has a lot of alternatives to offer to help the patients ease their pain. Palliative doctors assure their patients that they are still worthy of living. So, considering palliative care is the most excellent choice for helping patients instead of resulting in an assisted suicide.
Also, a person's best interest may not always be served by euthanasia. There are a number of circumstances in which a patient may request or feel compelled to request euthanasia despite the fact that it is not what they really want, presents a serious dilemma. Moreau was able to identify one of the leading factors for this occurrence. According to her, 90% reported a decline in their capacity to engage in life-enriching activities, meaning the majority of these individuals already lost their will to live. There are few contributing factors to this situation. One reason is that they have become depressed. Another is that they feel their condition is a burden to their family, and also because they lack the financial resources to continue taking their medication, and more. Regardless of these factors, euthanasia is merely one example that only further proves how it violates the fundamental bioethical principle which the medical community adheres to. It should be all about encouraging people to celebrate life and not about giving them more reason to desire death. Lastly, the practice of euthanasia infringes not only on the patient's right but also on the rights of other individuals. Typically, euthanasia is viewed from the perspective of the patients. However, it tends to be overlooked that those other than the patients themselves are burdened by the decision to encourage it. Hence, this also violates their rights as argued by Cole. For instance, from the doctor's perspective, even though it goes against his or her morals, he or she is obligated to do it because it is their job. Similarly, the pressure is also present for the patient's family or a close friend who may consent to euthanasia if they are granted the permission to do so. Moreover, it may also influence other individuals who are in a similar situation as the patient planning to participate in euthanasia, causing them to feel compelled to do it as well.
However, some still believes that euthanasia should be legalized. First, with their argument is stating that people have the right to end their suffering and die with dignity. So the second will be the cost-effective advantage of mercy killing, and lastly will be its benefit to the healthcare economics.
It's possible to argue about the way we've divided about up the arguments. That is why we are here to refute those claims through discussions.
So the first argument is every person has the right to die. In fact, individuals in a prolonged vegetative state or with chronic disease do not want to be a burden to their loved ones. So one example for this is the story of Harriet Scott, who was diagnosed with terminal liver cancer. So her story can be easily accessed via YouTube that has now reached 5.1 million views. So despite of her will to end her life along with her pain and suffering, no one is allowed to assist her in Canada since during that time, euthanasia was considered to be illegal. So however, based on the law, a person has the right to refuse medical treatment that can sustain and prolong life. So if this action was already well recognized in law, so why not euthanasia since both process or action leads to one path and that is death? At least in euthanasia, the person doesn't need to experience pain and suffering.
In line with this statement, it states about compassion. We can say that helping someone else to endure the pain is the most loving and compassionate thing to do. But Can we say that the most loving and compassionate thing to do is to show that their lives are valuable? And we can think of something else such as palli- palliative care or hospice. We don't have a control on their lives at the beginning, hence that will become. Not all patients who are terminally ill wish to die. They are fighting for their lives. They can still see hope based on their religious beliefs and support from families and friends. That's why at the end of the day, it's the patient's choice to choose the treatment for themselves.
So the second argument was euthanasia is a form of mercy killing in which a physician shall act with the patient's agreement to alleviate excruciating terrible suffering. But the concern was, how does it improve the economy? So according to these studies, euthanasia saves a substantial amount of money for families, insurance companies, taxpayers, and Medicare each year. So, for example, the estimated price of a hospitalization in a medical ward is 9,499 pesos per inpatient. So, this is only scratches the surface. So assume that a patient is terminally ill and has leukemia. So diagnosis for this will cost between 50,000 to 500,000 pesos. Aside from the diagnosis, the patient's family must also pay for the bone marrow, for the transplant, and the follow-up appointment. So euthanasia, on the other hand, is significantly less costly. Furthermore, after euthanasia, hospitals' stays are promptly terminated, and no other resources or attempts are employed to keep the patient alive.
For this statement, again, we simply stand that a person's life is valuable. Even the poor families strategize their medical needs like selling furniture, selling personal equipment like phones or laptops, selling accessories, asking for a loan in some cooperativa, and borrowing money from 5-6. These are their means. Even though it's really hard for them, still we can say that they are doing anything because the person or a member of the family that is ill is valuable for them. In Filipino saying, kumakapit sa patalim, just to extend the life of the patient.
So the last argument will be euthanasia can save medical resources in a resource-constrained healthcare system. So many individuals underestimate the expected cost savings from allowing physician-assisted suicide. So one explanation for this gap is that people frequently overestimate the cost of end-of-life medical treatment. So according to one observer, approximately 70 to 90% of our healthcare pesos are spent on the final few months of life. Others argue that the cost of treatment for dying patients account for over 30% of total healthcare expenses. That is based to Gyapong 2017. So if euthanasia will be legalized in the Philippines, this can actually help in saving sums of medical expenditures.
There is a high technology or advanced equipment that helps the medical expert to diagnose and cure the patient's illnesses. The government will help the hospitals, health centers to provide facilities to accommodate the patient's need. Today, the internet and mobile technology have made health information available to patients anywhere. Innovations in telemedicine now make it possible for patients to access a care professional whenever they need one. New education formats such as interactive walkthroughs, educational video, and text reminders give patient options through which they can consume health information and become more engaged in their care.
In conclusion to our discussion, the group upholds the policy to value the dignity of every person and guarantees full respect for human rights. Euthanasia must not be the solution towards a person's suffering, because euthanasia is equivalent to murder because it eliminates the patient instead of eliminating or alleviating the pain. Alleviating the pain is the alternative way to ease the suffering of the patient. Doctors cannot suggest euthanasia because it is unethical. Instead, they can suggest palliative care. Moreover, euthanasia is considered unethical because legalizing it devalues the sacredness of life, which can result to the changing view of society to the value of life. Following the major principle of bioethics, a person should pass with dignity through a natural process of death. So, battling a disease can cause a negative impact to the will of a person as well as their family to live due to many factors affecting their situation, which results that their best interest may be influenced by the situation. This dilemma, which violates the major principle of bioethics. It similarly works with the situation, are you killing the patient when you remove the ventilator and relieve the suffering with narcotic painkillers? The answer for this question is no. However, for euthanasia, the burden of the decision is put on the shoulders of the patient as well as their family members. So, some loved ones are burdened by the guilt due to the choice presented by the attending physician. And lastly, we acknowledge the fact that euthanasia is seen as a solution for many individuals and their family members due to economical constraints. However, the human right of a person and their family members dealing with the life-threatening illness to improve their quality of life can be achieved through hospice and palliative care. That would be all, and our references is in the next page. Thank you.
Thank you. Thank you so much.